we are in an area where there is the opiate problem is a serious problem. Our county last year had the highest death rate per 100,000 in New York State. So it is really an epicenter of this problem. When you think about this problem, it's a big problem. Opiate overdose is the leading cause of death for people under 50 in the United States. One of the opportunities that they looked at was what we call frequent flyers in the emergency department. These are folks that come in very often, and they have chronic problems. And the feeling was that those folks could be taken care of in a different setting. And the largest group of those are people who come in for chronic pain. And so our project was to redesign that whole process to reduce the amount of opiates that we gave to people and to channel them into treatment with our partner from the Institute for Family Health, which is a large federally qualified healthcare center. And they would bring those patients in, they would do a medical evaluation, and they would look at their problem and try to figure out what it was and take care of them. So if they needed interventional care because the pain truly was a pain, well, then they would get them into pain management where they would treat the pain at its source rather than systemically treating the patients with pain drugs. And then they had they had a psychosocial, they had a psychiatrist to look at the addiction problems, and they had care navigators to help them manage the system. We were able to reduce the amount of opiates that were administered in the ER to that population, which is a large population, by over 90%. We were able to just cut that out. And there's times when you do need it. So it isn't like we wouldn't do it, but really sparing, and we developed other protocols for treating pain that did not involve opiates. And over time, we've made quite a difference. We're hoping that these protocols will help, among many other efforts that are being done, to save lives and help people get into treatment and to get their lives back in order and move forward with their lives.